Hello, I'm Connie Ray, your host for Talk It Out Tuesday with Crisis Support Services of Nevada. We greatly appreciate the law enforcement officials who are joining us today to discuss a very difficult topic. Suicide impacts us all, but to the brave men and women who protect our communities, the daily stresses they experience can be traumatic. And today we're here to talk about how law enforcement is working to make it easier for public servants to seek out mental health care and what they're doing currently to eliminate the stigma. According to FBI statistics, 89 law enforcement officials were killed in the line of duty in 2019. Conversely, 285 officers died by suicide during that same year. This number does not account for the officers who have died by suicide, but their deaths were reported otherwise. It's a heartbreaking statistic. And in this 14th episode of Talk It Out Tuesday, Law Enforcement, Breaking the Stigma and Silence Around Mental Health, we'll be discussing what is being done to change the way mental health is being approached within law enforcement and how they're working to better assist officers who may be reluctant to seek assistance in dealing with traumas and stressors of their job. It takes an incredibly mentally sound person to handle the day-to-day stressors that law enforcement face. The people we are talking with today are advocating for healthy public servants. They're working towards better solutions, and they know we cannot ignore the situation. We have to talk about mental health in order to make it a standard of care. To discuss this important topic, we are joined by Washoe County Sheriff Darin Balaam, Sparks Police Department Chief Chris Crawforth, Reno Police Department Deputy Chief Oliver Miller, and as always, Crisis Support Services of Nevada's Executive Director, Rachelle Pellissier. Gentlemen, thank you so much for joining us to talk about this very important and difficult topic. Sheriff Balaam, to you and the other law enforcement leaders, these are not just numbers on a page. These are members of your law enforcement family. Can you tell us how these recent suicides within the Washoe County Sheriff's Office has affected the personnel at your agency? And what do you see as the right actions moving forward to support the men and women in this department?
Well, thank you, Connie. What immediately comes to mind is devastating. It was absolutely tragic when we had the first one on New Year's Day. And then 20 days later, when we lost our second family member at the sheriff's office, our office was still reeling and our personnel were still trying to grieve and wrap their minds and heads around the first suicide. So then all of a sudden to have the second one, it was absolutely devastating for our people. And thank goodness, all of us in this region, this is the topic we've been talking about for so long. And we've really, over the last couple of years, really been talking about it. But one of our peer support teams, after the first suicide, we had to reach out to the Northern Nevada Peer Support Network because as we had the second one, our peer support team was already mentally, emotionally, and physically drained. And a lot of them were friends with our first suicide person. So, they had to reach out, tap out. They had to emotionally set themselves back. And so for us, that was one of the best things, I think, moving forward of a model of how we are all leaning on each other because we're still trying to grieve from that and decide how moving forward do we prevent this because, having 285 plus probably last year suicides is way too many. And that's just in law enforcement and in our community. This last year has been mentally challenging for everybody. And I think for first responders, even more so just because like all first responders, law enforcement, healthcare workers, we had to go to work every single day. And as we were all trying to battle this, we were going to work. You can't patrol the streets. You can't work the hospitals. You can't work detention facilities from home. And so we all had that unknown fear. And then all of a sudden you add on this tragedies of our two losses and it was just devastating. So, one of the things that I'm proud to say, jumping forward of what we're doing besides our peer support, our EAP, building our chaplaincy was our county commission and both of our associations. So our deputy supervisor association and deputy association, we've been advocating for a mental health counselor embedded within the office. And our county commissioners have heard. And so at least to bring some relief to our members, they have approved a mental health counselor that will be hired in April, hopefully, permanent position within my budget. And that counselor will be here 40 hours a week. It'll be a member of the sheriff's office to start embedding, going to briefings, going to tragic scenes, and just be there as another outlet for our people to reach out to for help. So for us, we lost 2 members, but at least their deaths are not in vain. And so now, we are making momentum. Unfortunately and tragically, we lost them, and we don't want to lose any more.
Chief Crawforth and Deputy Chief Miller, we recognize that your officers on the front lines, they're not the only ones that are affected by these losses. Administrative, other non-sworn personnel also face the stressors of daily police work, including family members of law enforcement personnel. What actions are you taking to support this population? And what can we do as a community to help as well?
All of our agencies, we're not these massive agencies of like a Los Angeles where you're talking thousands of officers. So it's truly a family network. Our officers come in, the crazy thing you think about is we spend almost more time of our law enforcement family than we do with our families, just because of the hours that are required to work, 10 or 12 hours, and you spend hopefully 6 to 8 hours sleeping. That doesn't leave a lot of time with your true at home family. So I know some of the things that we've done is, and COVID obviously threw a little wrench in that. We had a spouses academy last year to bring them in and tell them they're part of the family. And here's some of the resources that are available through the city and through our department. And we want you to be part of the family. So we want you to come here. We want you to ask. And truly the key is, in our profession, people, they internalize everything. That's the historic, difficult part of law enforcement is I just take it home and I deal with it. But the families are the ones that are seeing that. So we've asked for their help. They see the changes at home. So the spouses through that, and then really reaching out, this peer support that we've all developed includes our non-sworn staff. So they're part of that because they are, we have records personnel that are reading the reports of what our officers are going on, and then they relate to them because they're saying hi and talking each day when they turn in their reports. And dispatch is the one on the very front line that's listening to this the minute it comes in, and some of these things that occur before officers can even make it there. So that's the peer thing is a big thing with that, and just the stigma of it's okay to discuss things. Because it has been in our profession that you take it home and internalize. Our big thing was about 16 months ago, we had an officer take his life, and that's still with us. So, but we've learned from that. And our big message is it's okay to talk about it. Internalizing it is, not the way to deal with it. And if it takes more time, historically in law enforcement, you deal through a critical incident or something that's happened, and we expect you to take a week or 2 off and be better. And now we've gotten over that where we talk about it a lot, and it's okay to take more time, and trying to change that stigma of you have to take it home and you have to live with it. So, and we don't know, each person is different. Each one of our officers, we don't know. We think it's going to be some major critical incident that affects them for the rest of their life. And it could just be that one call that only affects one person. And we all need to know that's okay. And also the communication amongst each other with peer of please, you see something, say something, when your partners are a little different today than they were yesterday. So something changed.
I think you absolutely said it best when we start talking about stigma. Stigma being a word that's often used for it. I like to call it culture. The culture of law enforcement that I grew up in, and good morning to you, Connie, is such that warrior culture, that warrior mentality. If you're not okay, you must not be okay for this career field. I can recall as a young police officer going to a awful call for service involving kids, and my FTO actually telling me that, hey, if you're not okay, if there's something wrong, then this must not be the career field for you. Trying to move away from that culture of just the warrior mentality and having it be okay for an officer, a civilian, anyone in the organization, dispatch, I think Chief Crawforth mentioned, anyone in the organization not being okay is very important. Changing that culture that we grew up with, those conflicting cultures that we have coming together with our newer officers. In a word, I would call it education as being a key component to changing the outlook, changing that culture that we're talking about in law enforcement. For example, I know that regionally, the Washoe County Sheriff's Office, Sparks Police Department, Reno Police Department, University of Nevada, Reno Police Department, they we all, as a region, incorporate 40 hours of critical incident crisis intervention training, CIT, into the academy. Officers get 40 hours of that. And then for us, after the academy, we have a component of officer wellness that we go through for a full 10 hours with our police officers, so they know they can actually reach out for help. They know that it's our executive team's priority, it's our chief's priority, it's the priority for law enforcement in this region. So changing that culture and really making it okay to ask for help, and to say when you're not feeling up to the job. Having those outlets is what's important, and how we, as an executive team, as a region, message that out to our people.
Our staff, as part of our initial training, we now have Chief Ken Quirk come in and talk to us about law enforcement and what they're dealing with. He keys in on what law enforcement internally and personally are going through. And the first time he gave that training, what really stuck with me was his words, unfit for duty. That our hero first responders and law enforcement, that fear that if they talk about any kind of mental health issues, any kind of struggles they have, or heaven forbid, suicidality, that they will be labeled and taken off the job as unfit for duty. Those words hold such gravity, for law enforcement, and how we get past that first thought that if I don't feel right, I'm going to be labeled unfit for duty. And I think we have to deal with how do we address that when they first come on the job, that's not a fear that they should have anymore, and being labeled with those kinds of, those kind of words.
Deputy Chief Miller, you mentioned that warrior mentality, and Chief Crawforth, why do you think that the stigma and ultimately the silence by some law enforcement when they're talking about mental health struggles and seeking help, are we able to change that culture? Are we able to work with them so that there isn't that fear anymore? And what steps are you taking to eliminate that?
So, I mean, it's just historical. It was just, you had to be this tough guy, and that's what society expected of you. And it just became part of our profession. I think what society is starting to recognize, which we appreciate, is that when we have these tragedies, when we have an officer involved shooting, it doesn't end there. These people carry that with them for the remainder of their lives. And that's just one of the, very significant events. But like I said before, it could be anything. And the tragedies that occur every day that these officers witness that become commonplace for them, that most people would not be able to handle. But we have to watch that. Within our agency, in the last decade, we've had 6 officers leave our service because of a tragedy they've witnessed or been part of, and they just couldn't handle it anymore. And that was some of that historical stuff where we weren't addressing it. So some of the things we've changed is when we have a critical incident, when someone says, I just need a break for a while, we make that happen. We get them off the road. We want them to be part of the family, so we keep them in the building if that's what they want. And, is there another assignment we can get you to for a while? One of the examples is if we have an officer involved shooting, when they come back to work and they're feeling that they're ready to go, they go out with another officer for the day. I can't, that's some of the things we look at, is I cannot imagine pulling out of the parking lot day one after you've been through this tragedy that you're carrying with you for life. And is the next call for service going to be something like that? Just that overwhelming burden on you. So one of the things we've addressed is you're going to go and you're going to be with another officer for the day. So you have someone there to talk it out with, and it's not to critique you or anything. It's been very clearly stated. This is just a double unit, and we want you to feel there's someone to be there with you for that day, for 2 days, for whatever you need. And we've had officers that have been in those in the last couple of years that they go out for a couple of weeks and they come in and say, I'm just not ready yet. And now, they're working with our detectives still in the building, working with our support services group. So they're not that day-to-day contact, but they're still part of the family. So that's how we've started to address that. And with this younger generation, DC Miller said it. I mean, it is a little bit different generation, but it's a beneficial one because they are more well, not more, they just, we don't have the old school thought anymore. We're able to bring in the new expectations, the new thoughts. So we're heading the right direction. I know we're not there yet, but we're on our way.
Sheriff Balaam mentioned EAP, the Employee Assistance Program. Deputy Chief Miller, what are other programs that your organization is using to proactively address the crisis for your staff? And then, like you said, changing the culture of silence.
Probably one of the most important things that we do is the coordination of all of our programs through our embedded resource officer. Brandon Castanelli's been a sworn officer with us for the past 15 years, but he's actually done a lot to change that culture of silence that we've traditionally had in law enforcement. He's a sworn employee. He's fully licensed also as a marriage and family clinician. So his sole job here at the Reno Police Department is to assist both sworn and civilian staff through any type of crisis they might have. He's been with us for about 15 years. He's been operating in this position probably for the last year and a half. And what we've learned is that stigma with reaching out to your boss, reaching out to your sergeant, reaching out to any other civilian supervisor may be in and of itself enough to stop one of our line level employees from asking for help. If your boss knows about whatever your ailment or issue is, then you might not be, right for this job. Well, with Officer Castanelli sitting in his role, that takes a lot of the burden off the shoulders from the person that wants to ask for help. Our personnel are able to, and he has access to any of them at any given time without our executive team, without management, without any of the first line supervisors getting to know that, an employee is reaching out for help. They are absolutely able to do that and they're fully anonymous when they do that. So he's had probably upward of 100 sworn and non-sworn employees reach out to him within the last year, 2020. And we see that number on the uptick for January and February so far of 2021. Now, some of his duties, when we talk about them, include coordinating all of our mental health related programs. He conducts interviews with some of our health providers to really establish a cultural competency level with them to make sure that they are indeed capable of assisting a first responder, because we're very much like the military. We deal with a lot of traumatic events, and we have an expectation, after placing our employees in front of hate and traumatic incidents that they take home with them, that none of those incidents actually impact them negatively, that they're going to be just fine the next day. And that's absolutely not true. It's very, very difficult to make it through this career field. But to answer your question, probably the biggest thing that we've done is that embedded resource officer and getting that position off the ground to be available to all of our personnel and to the region.
I've had a wonderful opportunity to work with Brandon, and he is just so passionate about his job, and he cares so much about each and every officer. He's just a wonderful addition to what you bring. What are other programs that are in place for law enforcement personnel who want to seek help when they're struggling, and who can they reach out to?
Some other programs include the peer support team. I think that each one of our individual agencies have them, and I heard Sheriff Balaam and Chief Crawforth actually mention them. We actually reestablished our team. We have about 30 members that currently participate with the team. We also have an early alert system in the department. It's a text-based system that periodically checks in on police officers who sign up for it. And that's all coordinated through Brandon Castanelli. The great thing about the system is that some of the resources that an officer might need are preloaded onto it, and it goes out. It's free of charge. I think the only thing they ask to maintain their infrastructure is that they're a referral destination. So you might have to look at some ads while you're getting your resources, but it checks in on you. We also partner with the Nevada Peer Support Network, and we've got to co-author a couple of projects with them. I know that Officer Castanelli works with them pretty closely, and for ease of operation, we've got all these resources kind of intertwined into what we call our Mobile Officer's Guide, or the MOG. At the touch of their smartphones, our officers and civilians, they're able to tie into the MOG to come up with all these available resources, peer support teams, names, numbers, and addresses of individuals on the peer support teams. There is also insurance coverage information, as well as vetted clinicians that they can go to if they need help, if they don't feel comfortable for whatever reason coming to anyone inside the department. One of the last things that I'll talk about just briefly is we're pretty excited about the creation of a first responder exclusive intensive outpatient program with Universal Health Services. Officer Castanelli has been working on that along with our executive team, but essentially outpatient care to our sworn officers to help them cope with stressors, to manage their mental health issues. There's opportunities for small group sessions. And, I know that especially when you talk about group settings with our law enforcement officers, there's a lot of concern about the potential for going out into a group setting and discussing your personal issues, with members of the community. Law enforcement feels more uncomfortable with law enforcement. So I think that might open, some of the floodgates for our local law enforcement to be more participative in their own healthcare and self-care.
I love the term self-care. I always say that self-care is not selfish. It's really about taking care of yourself and recognizing that it's okay, that you're not okay, but it's also okay to get help. And Rachelle, I would say too that crisis support services, you have a network of individuals that are there to offer their support. Who can contact Crisis Support Services of Nevada?
Anyone can contact Crisis Support Services of Nevada. We need to make it easy for our law enforcement, our dispatchers, anyone, any first responder to get help immediately. When they get in that place where they're in so much pain mentally that it's affecting, it feels like the only thing to get out of the pain is to die. They can't think as quickly as they usually would. And you really need to make it easy for them to reach out immediately to make that help. Make sure the phone numbers are at their fingertips to immediately get help. And I like to tell everyone, it's not just the person in pain. It's not just the law enforcement or dispatchers. We get a lot of calls from dispatchers. All of our first responders see so much, like we've talked about, but it's also their families. When your loved one is in crisis, you're in crisis. Having a family member reach out to us when they're seeing the signs and don't know what to do and know that their loved one is just in so much pain, family members can reach out to us so that we can help them through this crisis with their loved one, help them to be able to talk to their loved one and give their loved one the resources, help them through the situation. So, just speaking to the audience, anyone, whether you're law enforcement, whether you're sworn, whether you're not sworn, anyone, family members, all of you should reach out to us. And don't wait until the pain is so great that you're going to, the decision to die is at the forefront of your mind. We want you to reach out way before then. It's much easier, as we all know, to talk through those issues and get help and get the services you need before you're in that crisis. So anyone, again, can reach out to us.
I feel like this is such a great think tank. We're really putting a lot of various ideas and concepts on the table. And we as civilians have an insight into what is going on behind the scenes to help officers How do each of you feel about this think tank that we've created here on Talk It Out Tuesday? And you feel that this is helpful in moving forward to continue that conversation about mental health?
So, you know what, I would say, Connie, is absolutely. I think we've all hit on it. Both Chief Deputy Miller and Chief Crawforth, it's starting that discussion. So it's starting the discussion and it's getting people and breaking the stigma. So having this think tank for us to start talking about, it's okay. If you're not okay, it's okay to reach out. Here's some options. Maybe our personnel, or more importantly, our spouses or family don't know. By seeing this, now it gives them avenues. So absolutely.
And as far as think tank, I would just second the absolutely from the sheriff for sure. So I think the other part to this is us talking about it. It's as a community. So inviting the community into these officers are people. So, and they take this home, and we need you to understand that they're not just a badge and a uniform, that there's someone under there that's got to take this. So it's okay to talk as a group, and we need the community help to realize it's okay.
I absolutely agree with the idea about the think tank, especially with regard to coming together and talking about it. The first time I heard about suicide in law enforcement was last year during a police officer's funeral from one of our courageous leaders that got out there and actually said the word. So absolutely, yes, if we can come together and share and exchange ideas, I think it would help move us forward in changing the culture that we've been talking about and the stigma related to the culture of suicide and law enforcement and officer health. So yes.
And I think what's interesting and impactful right now, as we are still in the midst of COVID, is it has really brought mental health to the forefront. We see a lot of people who are struggling, but we also see so many various resources like crisis support services that are available. And again, we just thank each and every one of you for being here and for working so hard to change the culture within law enforcement. It's okay to not be okay, but most importantly, it's okay to seek help. I thank you all for joining us and for sharing some of the great programs and ways that the culture is shifting. And again, anyone, as Rachelle has mentioned, can contact Crisis Support Services of Nevada for support and to find services in the area. That number is available 24/7. You can call 1-800-273-8255. You can text CARE to 839-863. You can go to the website, a tremendous resource at cssnv.org. And we do want to remind you that Crisis Support Services of Nevada, they are a charitable organization, and they're helping all Nevadans and people across the nation. So if you are able to give, we ask you to visit the website. You can go to cssnv.org/donate. And again, thank you so much to Sheriff Balaam, Chief Crawforth, and Deputy Chief Miller for joining us on this episode of Talk It Out Tuesday. These are challenging times, and this is a difficult topic. Our hearts are with all of you. We thank you so much for everything that you do, all of your officers, men and women, the team, even those that are supporting the officers that are out there doing their job on a daily basis. As you all stated, this is a family, and we just want to support that family as much as possible as a community. So again, thank you so much for being a part of Talk It Out Tuesday.
Well, thank you, Connie.
Thank you.
Thank you, Connie.
We invite you to join us next month on Tuesday, March 30th for our next episode of Talk It Out Tuesday, Walk the Talk America, bridging the gap between mental health and safe firearm ownership. Again, you've been watching Talk It Out Tuesday with Crisis Support Services of Nevada.